Hello, it's Dr. Rhonda Johnson. Today is Thursday, September 1st, 2022. Today I'm discussing polio. Well, you've probably heard that polio has been detected in wastewater in one more county in New York. Now that is up to 4 New York City and 3 contiguous counties north of New York City. All of the samples are genetically linked to that one case of the man who has paralytic polio who never traveled outside the United States. Now, the Health Department of New York says all New Yorkers who are unvaccinated, including children by 2 months of age, people who are pregnant, and people who have not completed their polio vaccine series previously, should get a polio vaccine right away. Now, if you're unvaccinated and you're not up to date, and you're frequently in New York City, Rockland County, Orange County, or Sullivan County, the Health Department of New York says you're at the highest risk of getting paralytic polio disease. Now, outside of New York, who should get the polio vaccine? First, I want to encourage all people to get your immunizations and consult with your personal care physician or your health care provider. Always consult your doctor. So the information I'm sharing is abbreviated from the CDC website, but basically infant and children, as part of their routine childhood immunization series in the United States, get 4 doses of the inactivated polio vaccine. That's called IPV. They get it at 2, 4, and 6 through 18 months of age. And then they get a booster before they go to school, somewhere between 4 to 6 years of age. If your child is behind on their shots, many children got behind during the pandemic, please get your children caught up as soon as possible. Now, for adults, many adults in the United States are fully vaccinated against polio because they got it during childhood. That's why the polio vaccine, as of today, is not part of the routine adult vaccinations. However, if you're an adult and you're unvaccinated, or incompletely vaccinated, or you are completely vaccinated, but you're at higher risk for polio, you should get the polio vaccine. Now, the CDC says high risk for contracting polio means you're traveling to a country where the risk of getting polio is greater. That's Afghanistan, Pakistan, some parts of Nigeria. Or you work in a lab or healthcare setting handling specimens that might contain polio viruses, or you're a healthcare worker who's treating patients who have polio, or you have had close contact with a person who could be infected with polio. So the adult dose is, again, the IPV, the inactivated polio. You get 3 doses. The first dose at any time, the second dose 1 to 2 months later, and the third dose 6 to 12 months after the second. Now, if you have had partially completed polio series, you may have had 1 shot, well then get the other 2 doses of polio. Now, if you just want to make sure you're protected, the CDC says you can get a one lifetime booster dose of IPV. Now, remember that there's just one type of polio vaccine given in the United States, the inactivated polio vaccine. As a child, I know I received the oral vaccine, and in the first 20-some years of my pediatric practice, we gave babies and children the oral dose. But that was discontinued in this country in 2000. We only give the inactivated polio vaccine. It is believed to have 99% protection against contracting polio. So remember that polio was once a feared disease, one of the most feared diseases in the world, because it causes lifetime paralysis and there is no cure for polio. So please, folks, take this polio outbreak in the United States and London and Israel seriously. Check on your immunization status if you can, or if you're unsure and you're at risk, just get the one-time inactivated polio vaccine or get the full 3 series of polio shots. That's my message. If you live in the United States, I wish you a happy Labor Day weekend. Stay safe as always, folks, no matter where you are in the world, and be well.